Apart from being immensely important to feed the babies, breasts are cosmetically important to us. And one out of every 8 women at some point of their life will suffer from breast cancer. So, girls and women, let's shake off the shyness about our breasts. And today, we are going to discuss everything you should know about your breasts. This will also be an introductory video to my discussion on breast cancer. Breast cancer not only happens among women but also it can happen among men, for the obvious reason that males have breast also. But we very rarely encounter male breast cancer. It is in 1 is to 100 ratio. For every 100 female breast cancer, we only find one male breast cancer. Your breasts has these little ducts and lobules inside of it, and they start to mature once you are going through your puberty. However, this development is only complete when you are pregnant. This whole maturation process is due to our female hormones known as estrogen and progesterone. Your breasts enlarges and your nipple and areola matures once you are going into your adulthood. Many girls and women experience breast pain during their periods, and it is a completely normal physiological phenomena and there is nothing to worry about. This is just a hormonal change. It doesn't require any treatment unless extremely concerning. Your doctors might prescribe you some painkillers for that. It doesn't mean that you are having a breast cancer or you are at a risk of developing breast cancer. Breast cancers are quite well treatable and often curable. So, whenever you feel a lump in your breast, don't panic, just go to a doctor. If you are in your 20s or 30s, it is very less likely that it is going to be a cancer. There is something known as fibroadenoma that commonly happens in young age and it is not at all cancerous. Common age for cancer is during the age when you are attaining menopause, that is, your period is permanently stopping. When you present to your doctor, he or she will examine your breasts and your armpits and neck. Your armpits, medically termed as axilla, has these glands known as lymph nodes and they can harbor cancer cells if you at all have this cancer. Although these glands often enlarges due to infections also. Your doctor will ask you about your menstrual history, your childbirth history, and history of your family if anyone in your family had breast cancer. Are you at a higher risk of developing breast cancer? Well, there are a few established risk factors for breast cancer. Women who had period at a very early age, women who never had a baby or had a baby at a very advanced age, who continued to have period till their 50s, women who never breastfed, they are at a higher risk of developing breast cancer. High fat diet, alcoholism, all this can be attributed to breast cancer risk. Not all, but some forms of hormone replacement therapy can be responsible for your breast cancer. If you have a family history of breast cancer, that is one of your first degree relative, for example, your mother or your grandmother or your father had a breast cancer, then you have a higher risk of developing breast cancer because you may carry genetic mutation that can predispose you to breast cancer risk. Nobody is perfect, just like our genes. Many of us has defective genes in our body. If you have some defect in your genes like BRCA or P53, you might be genetically at a higher risk of developing breast cancer among other cancers. There are many other gene defects also that can predispose you to breast cancer and many more cancers that I will discuss in some other video. If you want to know, you can always ask me in the comment section below. I'll be very happy to answer. Breast cancer can present in many forms. It may form a lump, you can feel a dimpling over the skin, there might be an orange peel appearance over the lump, you may even have these little ulcers over the lump. Occasionally, your nipple may feel a bit scaly and ulcerated, and that can often indicate breast cancer. If your doctor suspects something bad, he or she will advise you to go for a mammography. A mammography might pick up some abnormality if there is any doubts of cancer. If you are young, your breasts are pretty dense and mammography might not pick up anything. So then your doctor might ask you to go for sonography also. You have definitely heard of an MRI scan. You can MRI scan your breasts also. Your doctor will ask for an MRI of your breasts if you have a silicone implant in your breast, if you have very dense breast, If you had family history of breast cancer, if there is any suspicion of breast cancer of both breasts, or if you had a history of radiation exposure to your chest wall at an younger age. In these cases, a mammography or a sonography do not pick up the breast cancer pretty well, and MRI scan will be better for diagnosing a breast cancer. If you are at a higher risk of breast cancer due to BRCA gene mutation or some other genetic causes, then also an MRI scan is recommended. Now, what does screening mean? When you belong to an at risk population, for example, if you are a female and you are in your early 50s, this is the common age for developing breast cancer. So, then you get yourself regularly checked by a doctor at a regular interval to rule out a breast cancer. Point to be noted is that screening is done on normal individuals who doesn't apparently have the cancer. And in case you have the cancer, then a screening test will diagnose your disease at a very early and curable stage. Breast cancer mortality has significantly dropped after introduction of these breast cancer screening programs. In a general population, every girl should know how their breasts should look like and feel like by the age of 20. Once you are 40 to 45, you should start getting mammographies done every yearly until you reach an age of 70 to 75. If you are at a high risk group, that is, you have a first degree relative in your family who suffered from breast cancer, or you had previous radiation exposure to your chest wall, or in case you have some genetic mutation in your family, for example, BRCA, then the screening programs should start pretty early. You should get breast MRI scans done every yearly with 6 monthly mammographies. Say if your mother had breast cancer at the age of 40, you should enroll yourself in a breast cancer screening program at least 10 years earlier of that age. That is, you should start your breast cancer screening from the age of 30. Self breast examination is a technique that every woman should perform every month. If you are still menstruating, self breast examination is recommended within few days after your period ends. In the shower, feel both of your breasts with your palm and look for any lump or any thickening in your breast. Stand in front of a mirror, put your palms over the hip and press gently. This will flex your chest wall muscles. Then you see if there is any puckering or any dimpling, any nipple retraction in any of your breast. You can also find out asymmetries in between your breasts. Don't forget that your right and left breast may not be an exact match in size, and that is completely normal. Then lie down on a flat surface with one arm behind your head and use the opposite hand to feel your breast for any lump. Also squeeze your nipples to check for any discharge. 80% breast lumps are not cancerous, but it is worth getting yourself checked by a doctor if you find any lump in any of your breasts. I will discuss what next if in case you have been diagnosed with breast cancer. But that is for next week. Wish you a very happy weekend. Don't forget to share this video and subscribe to my channel. See you next week.